Good afternoon. I'm Mr. Sunday Yohannah Dangyang of Texas American University. I'm presenting knowledge and practice of telenursing among nurses in Plateau State, Nigeria. The study was designed to study the knowledge, perception, and practice of telenursing among nurses in Plateau State, Nigeria. It aims at the need for good policy in healthcare delivery and implementation of telenursing to reduce to a greater extent the consequences associated with inadequate healthcare distribution. A cross-sectional study involving nurses in Plateau State, Nigeria was carried out with information on socio-demographic characteristics, knowledge of telenursing perception towards telenursing, and teamwork, willingness and attitude of nurses to use telenursing, and challenges affecting the implementation of telenursing in Plateau State were collected using a semi-structured questionnaire data were analyzed using descriptive statistics and chi-square test. The level of significance was set at 0.05. 270 nurses participated in the study. 54.8% had not heard about telenursing, though 43.3% have heard. 90.7 participants have never been engaged in telenursing. 84.4% stated inadequate resources affected telenursing practice. Majority, 84.8%, and 52.2% indicated interest for telenursing to be used and for improved communication and collaboration, respectively, between nurses and other disciplines. 66.5% agreed that telenursing is easy to use. Only 3.1% felt that telenursing may not bring any extra value to existing nursing practice when implemented. Lack of knowledge, 47.4%, funding, 80%, policy, 15.2%, poverty, 3.3%, time, interest, willingness, attitude of nurses, 2.6%, shortage of manpower, work overload, 4.8%, and inadequate power supply, 11.1%, were pointed out by participants as challenges that can affect the implementation of telenursing. Telenursing is the utilization of information communication technology to provide nursing care from a distance by nurses. It covers all locations, reducing the problem of inadequate and poor healthcare distribution, poor transportation system and topography, shortage of professional nurses, doctors. The inadequate distribution of health facilities and services has contributed to the background preventable maternal, neonatal, and infant deaths, as well as other preventable deaths that were denied as a result of poor health education or inaccessible health education. This led to the various forms of poor health habits by the people, like adopting for traditional medicine, rituals, and some other means in search of alternative care to bridge the gap of the shortage in healthcare provision. The advent of technology in medical practice has brought telemedicine, e-health, telehealth, nursing, telenursing to advance the course of care. Telenursing is seen as a good method of care delivery that aims at overcoming the challenges of poor healthcare facilities distribution, inadequate professional nurses, poor accessibility to healthcare facilities, poor transportation systems, and distance location, among others. I will go up. Rationale of the study. The outcome of the study will enhance the knowledge base of nurses on the need to utilize telenursing in meeting patient nursing needs in the community, especially in advantaged areas, and post-hospital admission, hospital management, and other policymakers will see the need to establish telenursing and telenursing centers in order to decongest the facilities and allow for patient follow-up, thereby reducing the physician waiting list and allowing nurses time to attend to other clinical challenges. Methodology of the study. Study area. The study was conducted in Plateau State, located in the Middle Belt region of Nigeria, covering an area of 26,899 square kilometers with an estimated population of about 3 million people. It has an estimated number of 1,200 nurses and midwives covering the tertiary, secondary, and primary healthcare institutions. Though this record may not be reliable, it might not be very accurate as a result of poor documentation and topography or highly disadvantaged sentiments and the crisis situation that affected the state. Study population. The targeted population composes of all nurses who are present within the period of recruitment in Plateau State, Nigeria, covering tertiary, secondary, and primary healthcare facilities. Duration of the study, 2 months, January and February 2017. Sampling size. The Yemeni formula was used to obtain the sampling size of 300. Study 2. The study 2 was self-developed close-ended questionnaire with options. The tool is divided into 2 sections. Section A, socio-demographic data of the respondents, and Section B comprises of questions to determine the knowledge level of nurses on telenursing, data to ascertain nurses' practice of telenursing, factors influencing the practice of telenursing among nurses, and influence of socio-demographic characteristics on knowledge of nurses on telenursing. Reliability. A pilot study was carried out among nurses working in University of Jos Clinic. The study was for instrument test-retest. A reliability coefficient of 0.75 was achieved. Collection of data. The State Commissioner of Health and the Chairman Ethical Committee of the State Ministry of Health gave an ethical clearance. Yet permission was obtained from the Research and Ethical Committee of the hospitals involved in the study. 3 research assistants were trained for a day on methods of collecting data to assist with the data collection for a week. Analysis of the data. Data collected were analyzed using statistical package for social sciences, that is SPSS version 23.0. Both descriptive statistics were used to analyze the data and Pearson correlation to test for hypotheses. Results. A total of 270 questionnaires was filled and returned out of 300 that were shared. The findings were on a total of 270 questions. The majority of the respondents were female, that is 79.6%, 20.4% male, signifying that majority of nurses in Plateau State are female. The respondents, most of them are above 40 years of age, signifying the level of practice which might be related to their knowledge in technology. To assess the general knowledge, I think I have to assess the general knowledge, 60.4% respondents have the certificate in nursing, 23% respondents have Bachelor of Nursing Science, with only 1.0% having master's degree. On knowledge of telenursing, majority 41% responded do not have any form of training in respect to information technology, while the rest have ranging from certificates to diploma and bachelor's. However, 54.8% said they have not heard about telenursing before, while 43.3% said they've heard about it, mostly from the internet. 17.8% indicated that they heard about it from the literature in the internet. Sorry, these things are so tiny. 91.1% had not practiced or engaged in telenursing practice. The rest, 8.6%, responded that they have heard about the telenursing. 18.9% have not been to telenursing practice healthcare centers, but the majority, 79.9%, also indicated that they have not been to telenursing practice center. That shows majority have never practiced telenursing nor been to centers where it is being practiced. In perception, 75.2% supported the fact that telenursing allows for timely monitoring and provision of care to outpatients, while the rest, about 28%, opposed to it. 83% respondents do not see the need to use it in their unit to follow up discharged patient. However, about 40.6% do not see it as a possibility for teleconsultation with patients and other nurses, while 58.5% agreed that it can be used for teleconferencing. 46% agreed against the majority, 52% that disagreed that telenursing cannot be used for conferencing and knowledge increase. 64% responded positively, though 34.4% did not believe so when they were asked about team spirit in their place of work if telenursing is practiced. 84.4% were of the contrary opinion. Therefore, funding should be looked into and improved to ensure quality and wider telenursing services. When they were asked about the hurdles affecting telenursing implementation, the response was observed from respondents when asked if everyone's opinion was usually heard, which shows that 65% indicated that this was not the case. This shows that respect for opinion need to be worked on, as lack of respect for opinion may affect implementation of telenursing. 63.0% affirmed that they were encouraged to report any concern during telenursing practice. On attitude, information on willingness and attitude of participants towards the use of telenursing was also sought for. 84.8% indicated that they want telenursing to be used in nursing practice, while the rest opted for it. 69.9% respondents disagreed with the assertion that nursing care is effective. Discussion. From the study, participants had moderate knowledge of telenursing, while the majority had inadequate knowledge. This is contrary to a study in South Africa, where the knowledge and practice are high among nurses. Conclusion. Though there are various opinions on the knowledge of telenursing among nurses, it can be said to be good, though complete knowledge about the component of application was not clear. That shows that more nurses need to be educated on the need for telenursing. Finally, the role of administrators in the planning, implementation of telenursing cannot be overemphasized. There could be collaboration of all the unit heads, particularly in nursing unit, for a successful implementation. There's also need for training and retraining of nurses on telenursing. Recommendation: the need to improve care utilizing telenursing cannot be overemphasized. Therefore, it is recommended that the government, non-governmental agencies should collaborate and assist in the development of telenursing that will assist patients that are very far off and are living at disadvantaged area. Gaps in the knowledge of telenursing and nursing practice has led into argument its accessibility for improving nursing practice, nursing care accessibility at all locations, explore to telenursing practice for nursing, clinicals have been advised. So these are the areas. Thank you so much.